How does Invisalign work?
So Invisalign basically works by slowly moving your teeth, and how it essentially works is instead of wearing the traditional brackets or the braces that you would normally wear, you wear these clear retainers that slowly shift your teeth. You change the aligners every 2 weeks, and let's imagine we're trying to take your tooth from this position across to this position. So each aligner will just very gradually shift your teeth this way.
How long should I wear Invisalign aligners each day?
So the biggest thing with not wearing Invisalign aligners is that you need to wear them. Otherwise, the teeth aren't going to move. So it is recommended to wear your aligners 22 hours a day. So basically, you're free to take them in and out as you need. But generally, our recommendation is to try and wear them as much as possible.
Should I remove my Invisalign aligners before eating or drinking?
That is an excellent feature of Invisalign compared to traditional braces is you can literally take them in and out and eat whatever you like, whether you like to chew gum, whether you like to drink coffee, it's all okay.
Will Invisalign affect my speech?
No, the nice thing with the human body is that we're pretty versatile. We get pretty used to things pretty quickly. You may notice a tiny lisp maybe for the first 2 or 3 days, and then most of my patients they're back talking completely normally with the retainers within the first week.
How should I clean my Invisalign aligners?
So every morning when you wake up, you can just take them out and rinse them under some lukewarm water and just use a wet toothbrush with no toothpaste. The nice thing is you are changing these every 2 weeks, so you get a brand new fresh set every 2 weeks.
Can I whiten my teeth while wearing Invisalign?
Absolutely. So that is another nice feature of having the aligners is the aligners serve as a reservoir for your dental bleach. So yeah, absolutely, you can whiten your teeth.
Is Invisalign treatment painful?
So in terms of pain and discomfort, there is very, very, very minimal pain and discomfort as opposed to traditional braces. Because everything is planned and 3D simulated on a computer before we do anything, it tends to take a lot of that discomfort and pain out of the equation.
What if I lose one of my Invisalign trays?
It's a pretty straightforward process. We can either get you to move on to the next aligner, or if we need to, we can give the aligner company a call and order you a new aligner complimentary.
What is the difference between Invisalign and braces?
So the biggest difference between Invisalign and traditional braces is that traditional braces are glued onto your teeth. So, you've got a wire running all across the front of your teeth, whereas Invisalign, they're removable, so you can take them in and out. In terms of the movements that Invisalign versus traditional braces can do, they are finding that Invisalign can pretty much do what traditional braces are able to do. So the biggest difference is that Invisalign is removable. You can eat, drink, whatever you like. You can live life as normally as possible. Whereas with traditional braces, there is definitely an adjustment.
How do I know if Invisalign or braces are right for me?
So the best thing that I would suggest is give our office a call. Come in. We're happy to do a complimentary smile assessment for you. And the nice thing is we have all this technology at the office that can literally show you what your teeth could look like if we were to correct them, or if we were to enhance your smile.
Is Invisalign as effective as braces?
Traditionally, they used to say that Invisalign couldn't do certain movements, but just with the advancement of technology and how it's going, it's pretty rare to need braces these days.
How long does Invisalign treatment take compared to braces?
So treatment time just depends on what kind of movement or how aligned or crooked your teeth are. And so essentially that dictates treatment time.
Is Invisalign more expensive than braces?
No, so the cost of Invisalign just varies again, depending on how much movement we need to do. If generally the cost can vary between $5,000 to $7,000. So $7,000 if it's really complex movements that we're trying to correct.
Can teenagers get Invisalign or braces?
Yes, so teens can definitely get Invisalign and braces. The biggest thing that my recommendation with teenagers is that we want them to wear the aligners. So sometimes teenagers, depending on your child, if they are really a responsible child, I've had no issues with Invisalign for teenagers. But if you've got someone that you have to constantly remind and you constantly tell them what to do, sometimes braces might be the better alternative.
What is the best age to start orthodontic treatment?
With orthodontic treatment, they're finding that the younger you are, the better it is. So, even if we don't start the straightening process, what we do want to do is just do an assessment, because there are things that can be done at a much younger age that can minimize how long your child needs orthodontic treatment for.
Are Invisalign results permanent?
Mother Nature never intended us to be perfect. And so if we're giving you the perfect smile, there is a little bit of upkeep involved. So once you're done with treatment, we give you these removable retainers that you're to wear at nighttime, because what the body wants to do is it wants to move the teeth back to how they originally were. And, so that's one of the big things that I really encourage my patients to do, is to wear the retainers so that we can guarantee their smile for life.
Can I switch from braces to Invisalign during treatment?
You definitely can. It's wise to give our office a call and we can get you in for an assessment and then take it from there, assess your options from there.
What is the price of Invisalign treatment?
So the cost of treatment varies depending on the complexity of, what we're trying to correct. On the simpler end of things, if it's a very, we'd say moving a few teeth, you're probably looking at closer to, $5,000. And, if it's a more advanced or we're really trying to correct a bite issue, at most you're looking at $7,000.
Does insurance cover Invisalign or braces?
So with insurance, what we can do is we can send off a predetermination to your insurance company to let us know if you do have or how much your orthodontic coverage is.
Are payment plans available for Invisalign?
Yes. So we understand that the cost can be prohibitive for some people. So yes, we do offer in-house and external payment plans to help make things affordable for you.
What should I do first if I want orthodontic treatment?
Best step would be to give our office a call and we'll get you in for a complimentary smile assessment. And from there, we can get the planning process started.
Can orthodontic treatment change facial appearance?
Putting teeth in the right position can definitely improve or enhance your facial position or facial profile. Certainly, that's a holistic approach that we take in terms of factoring in where we would move your teeth to give you kind of the ideal facial proportions.
What are the biggest patient errors during Invisalign treatment?
So the biggest mistake that I see is not wearing your aligners. So the aligners work as long as that you're wearing them. So that is something that I really, really try to encourage with my patients, is the more you wear them, the more predictable the straightening of the teeth is, the less time that you have to have these. The other thing that I do notice is that, you want to make sure you're cleaning your teeth really, really well while your teeth are moving.
What should patients know before starting Invisalign or braces?
So my best advice would be to give our office a call and book in for a complimentary smile assessment. And, we can give you all your options from there.